Yeah. This, that mind, that body, that LA flow, where we breathe deep, move free, let the good vibes grow. Talking healing, hustle, balance, and peace, from the heart of the city to the soul of the streets. Mind, body, LA, where wellness meets the West every single day.
Hey y'all, welcome to MindBody LA.
Where we talk about real talk on mental, physical, and emotional health, but with a little bit of LA style.
Yes, I'm Ashley Ambers, physician assistant working in family medicine right here in Los Angeles.
And I'm L'Aurelle Deogratias, a psychiatric and mental health nurse practitioner.
And if you didn't notice, we are sisters.
We are sisters. So you're getting a little bit of clinical insight and some sibling energy, okay?
Heavy on the sibling energy.
Yes, girl. So this is our first episode, and we want to just start with something that's a little bit foundational.
The thing that people avoid the most, but they need the most. And that is primary care.
Okay. Yeah.
So basically, this episode is really a loving intervention.
Because literally, people will do everything except for established care.
They're going to Google symptoms, look on ChatGPT.
Girl, they're going to be on Instagram, YouTube.
They're going to drink their herbal tea, take their CMOS.
They're going to pray.
Or text a friend who knows a nurse.
Don't text me. Do not text me, okay? I need you to text Ashley.
But, remember, I'm not a replacement for your primary care. You still need a primary care. So let's be honest. We hear these things all the time.
Yeah.
I feel fine. I don't have time. It's too expensive. Doctors don't listen.
Yeah.
I don't trust the system.
I mean, and those are valid concerns, but you still got to go.
100%.
Because mistrust in healthcare is real.
It is real. Access issues are real.
Yeah. I mean, schedules are busy. You have a lot of things to do. You have work.
The kids.
Yeah. But
6 kids.
6 kids between the both of us.
But waiting until something happens is honestly, it's just too late. It just makes the care so much harder.
Yeah, it does. I would agree with that.
So let's break it down very simply, right? A primary care provider is your home base. And who could be your primary care provider? That could be a doctor, an MD, a DO. That could be a PA like myself, or a nurse practitioner.
Yeah, but not me. I'm not family, okay? I'm mental health, okay? So I would not be your primary care physician, okay?
Right. But what happens, right? So your primary care providers, they're going to track your history. They know your history. It's a way for us to prevent problems from happening early.
Yeah.
And we're going to treat issues when they arise.
Yeah. And they will know you. They will actually know you and know your journey, know your medical history.
I think the most important thing here is having that relationship, right?
Yeah. Okay. So hypothetically, if you were my primary care physician or my primary care provider, okay, what do I expect? What do I expect in a visit with you?
So typically when it's a new patient, it's a little bit more comprehensive. And if you happen to schedule your preventative visit during that time, just expect us to go over all things, including dental care, your vision, your gynecologic history. We're going to talk about all of your age-appropriate vaccines, screenings, what do those look like, timing, and then also just expect a very thorough social history. Where do you live? Where are you from?
Yeah.
Family history, because those things can certainly increase one's genetic predisposition to certain disease processes. So we take a deep dive into your history, and that really helps us as your primary care provider, assess you as a patient, but then also kind of make recommendations for where we go from here. We'll do labs, we'll do a thorough head-to-toe physical exam on you. And so after that visit, we'll follow up and we'll let you know what are the next steps also. Do you see me in a year?
Okay.
Or do you need to come back in 3 to 4 months, depending on the findings from those labs?
Okay.
So definitely, it's very comprehensive. It's just not a one-time visit. And I think that's where we kind of circle back around to the relationship. It is a relationship. We just don't see you once and done. We're going to be seeing you hopefully for years.
Okay, so I have a question then. So are you able to see, as a primary care provider, are you able to see myself and my family?
Absolutely. And so I think that's if that is a need for you or a want for you, you would want to look for someone who's in family medicine, because typically family medicine see all ages. I generally will say we see from the cradle to the grave.
Okay.
Internists generally will see more adult patients.
Got it.
So 18 and older. So if you're looking for someone who can see you and your children or your family, you would want to look for a family medicine provider.
And is that what you are?
That's what I am.
Okay.
Absolutely.
That's what I'm talking about. That's what I'm talking about.
I see all ages.
Oh my
So
God.
remember, primary care is just not when you're sick, right?
Yes, it's for staying well, and you want to make sure that you're seeing them often.
And so the preventative care, we'll do your annual exams, like I mentioned, we'll do blood work, we'll talk screenings.
Okay.
And so here's the scary part, right? Some of the most common diseases don't have any symptoms.
Oh God.
Think
Okay.
about hypertension, also known as high blood pressure, silent, diabetes. Not all patients are symptomatic.
Yeah.
High cholesterol, some cancers, no symptoms.
Lord Jesus. Okay, so no symptoms, no warning signs.
No.
So
And sometimes by the time symptoms do appear, it's advanced
yeah,
and it becomes so much harder to treat.
what you're saying is prevention is necessary. Like you
Yeah.
need to be able to see your primary care because it's power.
Yeah,
Okay.
100%. So I see this all the time. I have patients who come in, no judgment males, but often males who have not been in to see the doctor for years.
Oh my goodness.
10 years have passed, and oftentimes we'll ask, okay, what brings you in?
Yeah.
And naturally, they're like, well, my partner, my wife, somebody told me to come in. It's not like they made the decision to
They
come
mama.
in. They were forced into making a visit.
Yeah.
And 10 years have gone by, since the last time they've seen a doctor or a provider. And now they're here.
Yeah.
We check labs, hypertension, diabetes, high cholesterol. It's overwhelming.
That's very overwhelming.
Going from what you believe to be a healthy state to all of a sudden having all of these chronic conditions
Yeah.
is very overwhelming.
Yeah. I mean, I couldn't imagine going in thinking I'm going to see a routine or having a routine visit.
Right.
And then them telling me that I'm broken.
Right,
Like
right.
everywhere, like from
Right.
the top to the bottom.
And you on 3 different prescriptions now.
Yeah. I
Yeah,
mean, that could be very overwhelming.
Yeah. So again, it's so much easier catching things in an earlier state. It's much harder when we catch it, late. So
Yeah. But you know what's interesting about that too? Primary care is usually the first stop for mental health as well. Like we
Yeah.
want to make sure that like if you're coming in for anxiety, that it truly is anxiety, that it's not an actual like
right.
primary care challenge that you actually need to go see your provider about, because a lot of times people will think that they're having mental health challenges and they have not been to the primary care doctor or physician or nurse practitioner in years.
Yeah.
So that really should be their first step.
Definitely. Patients can present with, say, for instance, anxiety, and it could be a thyroid issue.
Right.
But if you haven't had your thyroid checked in years, we don't know.
Right.
And again, it's so important to establish a baseline.
Yeah.
We'll check everything from your kidney function, your liver function, your thyroid function, your electrolytes, calcium, sugar. Where's your cholesterol? What's your A1C look like?
Oh my gosh. Yeah.
All of your cell lines, white blood cells, red blood cells, platelets. If you have not had labs done in a very long time, how do you know where you are?
Right. You don't know where you are.
Yeah. And again, you may feel fine, but that does not always equate to being fine.
Yeah.
Right.
Yeah.
So it's important to establish care, but not only establish care, actually go in and see your primary care doctor or provider, and not only when you're sick.
I agree.
Because truthfully speaking, if I were to ask the general population, when was the last time you saw a provider when you were not sick? I would say upwards of 75% of patients, and I might be overestimating, they can't give me an answer.
That's wild.
Because oftentimes when you feel something, that then triggers the need, okay, let me schedule an appointment. But it's very rare that someone's like, oh, I just need my routine, visit. Let me go in and see my provider.
Yeah. They only go in when they feel something.
100%.
Versus just like
it shouldn't be like that.
The preventative effort.
Yeah,
Okay.
it shouldn't be like that.
Even with mental health, the stress, the anxiety, the burnout, the depression, all those things can be treated sometimes if you saw your primary care provider first, because a lot of them are actual physical issues that maybe are stemming from something else.
This is a public service announcement. If you don't have a provider who knows you, please go and look for one. Establish care with one.
Yes, please. After you see your primary care, then come to me. And then we can talk about some mental health concerns that we actually can include in that physical assessment.
Yeah. So let's just go into like some real life examples that I see all the time.
Okay.
You know, I've had a cough for 3 months and I go to the ER. I see it all the time.
Oh my God. Okay, sir.
Please understand this. The emergency department is for emergencies only.
Yeah.
Right? You know, now if you're short of breath or you're having crushing chest pain, please go to the ER. However, if you've just been having a cough for 3 months, go see your primary care provider.
Yeah.
The ER is not the place to go. And what do they always tell you when they discharge you? Follow up with your primary care provider.
Yes.
In 2 weeks.
Yes.
And if you don't have one,
then there's no follow-up. Yeah.
There's no follow-up.
It's so
There's
true.
no follow-up.
It's so
So
true.
remember this, the emergency room is for life-threatening symptoms.
Yeah.
Again, you know, immediate stabilization. Primary care, more long-term health tracking, screenings, you know, chronic care. And so just in case you don't have a primary care provider, you know, just be very practical.
Yeah.
You know, look at your insurance, see who's in network. Call your insurance if you don't know, and they'll give you a list of providers who are in network, and then you can kind of make the selection there.
Yeah.
Look for someone who you feel like would be a good fit.
Yeah. I mean, I think that's super important. I mean, because everyone is not a good fit. I mean, you guys can, well, not you guys. Well, you guys can look up, you can look up the provider that you see, maybe on your insurance card or that's a network with your insurance, and then look for reviews.
Yeah. Yeah.
You know, look for things that are common between the provider and yourself. I mean,
yeah. And here's the thing that I will say, you know, I get that people look for, you know, say for instance, you're a woman, you might want to see a woman. And I understand that. Same thing for males. You know, from the preference of ethnicity, I have a lot of patients who come in and they want to see someone who looks like them. But I always say, please keep your options open. Because just because they look like you don't necessarily mean that they're a good fit for you.
I would 100% agree with that.
Yeah, yeah. So definitely kind of look for someone who spends the time to answer the questions that you do have. Some people like quick, and that's fine. Some people like, you know, taking their time to ask questions. They want someone who's going to spend the time with them, you know. And so whatever your preference is, please look for that in a provider.
Yeah.
And stick with them. You know, I feel like nowadays we kind of have a culture of what I call popcorn medicine. And it's where you'll see one provider one year, you'll see another provider the next year.
Yeah.
You'll see someone randomly, you know, if you need something. Like the whole purpose of having a primary care provider is, again, to have that relationship with them.
Establish the care.
They know you the best. So if there's anything subtle that may be off, they follow your trends. See someone who I've been seeing for the last 6 years, and I'm like, hey, what's going on with your blood pressure? It might not necessarily be at the point where we're talking about medication, but it's way beyond your baseline.
Yeah.
What's going on?
Well, you know their baseline.
Exactly.
Somebody else that you just met does not know your baseline.
Exactly. And that can sometimes open up the conversation to talk about things like stress, right?
Yeah.
You know, your blood pressure could be affected by your stress levels. And if I'm like, okay, blood pressure's high, you start to kind of open up about the things that are occurring in your life.
Yeah.
Maybe that's a way for me to say, okay, I think you would benefit from speaking with someone about this.
Yeah.
A therapist, a psychiatrist. And again, a lot of things present initially in primary care.
1,000%. 1,000%. I have to agree with that. I think people get nervous about their first visit, but I mean, I would hope that there's no judgment.
Yeah, it's a no judgment zone.
Yeah.
Even when patients come in and they're overwhelmed and they're crying, please know this, we do not charge for tears, okay? Like, we don't. So if you feel the need to cry, please cry it out.
Girl, cry it out.
Cry it out. We don't charge. We're not billing that. There's no billing code for a tear.
She cried too much in this visit, so we're going to have to bill her a little extra, okay?
Absolutely.
Oh, my God.
So just expect for your first time a very comprehensive visit. Again, we're going to check labs. We're going to check you head to toe. We're going to go over your history, all of those things, okay?
Yes.
We'll talk about your sleep. How is your sleep? Are you sleeping 4 hours? Because that is not adequate. Let's talk about that.
Ooh.
Let's talk again about your stress, your diet, your physical activity. Are you sedentary or working out 4 to 5, days a week?
Ooh, that's a lot.
That's a lot. That's a lot.
But that's nice.
That's
45
nice.
days.
That's let's talk about, your work. Is it a toxic work environment?
Oh my God.
All of these things. So
Yeah, and create a plan together
Yes,
with your
yes.
primary care. Yeah, and I mean, primary care is about ownership. You know, we don't want to wait for
A
a
crisis.
crisis.
Yeah.
Yeah.
Because again, sometimes we're just so far gone at that point.
Yeah.
It's really difficult to pick up the pieces. So,
And then you can kind of get your power back with,
Yeah.
you know, being just establishing that primary care visit. I mean, it's power, you
Yeah.
know, in the prevention. Prevention is power.
if you could not answer the question about when the last time you saw a doctor or a provider when you were sick,
Yeah.
when you were not sick, then that's probably a sign that you should probably schedule an appointment.
So I have a question. So how often would you say then that you should probably check in with your primary care provider? Like every 6 months, every 8 months, yearly?
I mean, at the very least, annual.
Okay.
Just come in once a year. And at that point, we'll do your physical.
Okay.
You know, your physical, you know, also kind of called your preventative visit or your wellness visit. And again, because physicals are an opportunity for us to prevent things,
Okay.
you know, we're talking about wellness. How can we kind of pivot or improve things so that you can be in a better kind of place in your life from a healthcare perspective? But then also doing a head to toe physical, all of those things are accomplished in the setting of an annual wellness visit. But say, for instance, you do have chronic conditions, you should be seen a lot more frequently.
Okay.
And once you get to more of a controlled state, then we'll discuss what that follow-up looks like.
Y'all heard her. So go book that appointment, okay?
And remember, if you don't have a primary care provider, this is your sign. So follow us, share, send to someone who's been avoiding the doctor. We all know somebody.
Yes, we do.
We all know somebody. So see you next time.
Thank you guys for watching. See you on the next episode.
This is MindBody LA.
MindBody LA, where wellness meets the West every single day.